Good morning, moms in real estate. I cannot wait for this conversation this morning for so many different reasons. First is it's completely different than anything we talk about, but yet I have conversations with women, moms in real estate all week, every week. And this topic actually comes up a lot. So I'm going to welcome our guests and then we're going to dive into the topic. So Sara Sauder is here. She's a friend of our friend Elena, which you guys all know in the group because she's one of our amazing partners. And she told me, Kristen, you've got to have Sara on. And so we have her on today. And she is a pelvic floor specialist. Is that what I would call you?
Yeah, I'm a pelvic floor physical therapist.
Physical therapist. So we're going to be talking about our pelvic floor. And I know, like, if you guys are like me, I can't go jump on the tramp with my kids anymore because you pee your pants a little bit. There's so many things that go into the pelvic floor conversation. So I'm totally open-minded. I cannot wait to learn from you, Sara. So thanks for being on.
Yeah, thank you for having me.
Yeah. So tell us all about pelvic floor stuff.
Okay, so the pelvic floor is really interesting because it impacts everybody every day, and yet we don't all recognize that we all have pelvic floors. So women have pelvic floors, men have pelvic floors. It's like saying women have noses, men have noses. We can't function without it. Even though sometimes you hear even famous celebrities like Dr. Oz say, I'm glad I don't have a pelvic floor, which he has said before. Um,
Why?
Inaccurate. He's a cardiologist. I guess that's where his focus was. He never looked below the torso. But the pelvic floor is a group of muscles, it's a location, and it's the muscles we use to function properly, to poop, to pee, to have sex, to sit, to function properly. We won't have feelings there, which is why a lot of us don't know we have a pelvic floor. So when our pelvic floor is problematic, we'll have pain or we'll have excessive symptoms that aren't necessarily painful, but they're problematic, like peeing all the time, constipation, not being able to orgasm. Painful symptoms can be tailbone pain, SI joint pain, just back and hip pain can be from the pelvic floor. Sometimes I get patients who have chronic back and hip pain and they do their traditional physical therapy or chiropractor route, and then it gets better a little, but not completely, or doesn't get better at all. And then sometimes you got to think, okay, maybe the problem is the pelvic floor because these muscles affect everything.
Yeah. Well, and so do you find that women usually start to be symptomatic after giving birth?
So that's what a lot of people think is we become symptomatic around pregnancy or giving birth. But in reality, I think people become symptomatic unrelated to birth. People become symptomatic when they live high stress, type A, super detail oriented, ambitious lives. So most of my patients are actually super successful people, and they don't really come to me because they've had pregnancy or delivery. They come to me more because their pelvic floor muscles actually get really tight, and that creates symptoms. So it's like we're very used to thinking I've got shoulder pain, neck pain, headache. I've got so much tension. I've got so much stress. We like to think about stress sitting up in our neck and shoulders, but stress actually sits more inside our genitals, which is where our pelvic floor is. So we don't get headaches from that. We get like the need to urgently pee. We get urinary leakage when we cough and sneeze and laugh. We get waking up at night or like nervous peeing before we go to bed. Or we're constipated and we notice sometimes, oh, actually, I do notice I'm more constipated when I'm stressed. Um, and painful sex. Sometimes people have more pain with sex when they're stressed. You can have symptoms alone that are provoked from having a cesarean or delivery because that is a massive trauma for the pelvic floor muscles. And the typical thing you see after that is leakage with coughing, sneezing, laughing. Um, but most of the people I see, it's from being super ambitious, super successful, super driven personality types.
Wow, that's crazy. So when do you feel like people have the aha moment that, oh my gosh, I need to be working on my pelvic floor? Because I feel like it's not talked about and it's like something that maybe now somebody's listening to this and they're like, they're like self-diagnosing, like, oh, it's my
Yeah.
pelvic floor, but I feel like it's not this like thing that we're taught.
Yeah. So the problem is that it's also not taught to physicians. So you have this medical issue, you may go to your urologist and say, I'm getting UTIs all the time. But your urologist wasn't necessarily taught that the pelvic floor has anything to do with this. And so you can go down one direction, and that may not be the direction that's looking at the pelvic floor. I feel like people are only really looking at it because I think social media is doing a really good job of talking about the pelvic floor. Now that we have more autonomy and like we can reach bigger populations through like just Instagram or TikTok, and there's algorithms now. And now that your phone is like listening to you, and
I know,
now
I can't wait to go on Instagram later. It's gonna be all pelvic floor stuff.
yeah, it's going to be all pelvic floor stuff now. And so I think that's created more awareness, more so than anything that physicians are doing. There are specialists out there who are really good, but they're probably not it's not run of the mill yet. People are not going to really think about the pelvic floor as part of your symptoms until probably 15, 20 more years.
Wow, that's crazy. So maybe give us like a couple scenarios, like what are the most frequently asked questions that your clients have for you that you can
Yeah.
help them with?
So questions that people have. I have a lot of people, and what might pertain to your audience is I have a lot of people in perimenopause, and there's a lot of symptoms of the pelvic floor when your hormone levels change. So, couple of things. When you have a baby and you're lactating naturally and you don't have a period, you're actually in menopause when you don't have your period. So your body is having hormone changes. You go through that again through perimenopause. Um, in perimenopause, your periods are fluctuating, like the time between periods change, the heaviness of the flow can change. In perimenopause, your hormone levels drop quite a bit in the vaginal tissue, and that affects your bladder as well. We have tissue like at the opening of our vagina that is the same as your bladder and urethra, and a lot of physicians are not really aware of this yet. Um, so people in perimenopause are like, okay, what's the number one thing I can do? And the number one thing I would say if you're in perimenopause and not symptomatic yet, or not sure if you're symptomatic, is start getting on vaginal estrogen cream. And vaginal estrogen cream just got the black box warning removed like within the past 12 months, maybe like 6, 8, 9 months ago. So there actually is no female that can't take vaginal estrogen cream. So it's a cream you put in like an inch worth into the vagina, and that helps keep the health of the bladder, urethra, and the vagina, so that you are less likely to have leakage, you're less likely to have infections, and you're less likely to have dryness. A lot of people don't think about it for your bladder health. So the number one thing I tell people is, hey, prophylactically get on vaginal estrogen cream. It will do a lot to prevent symptoms from starting. But if you have any urinary symptoms, it's probably going to help with that.
Yeah. Oh, Christy says, I've never heard of this. This is great info. And right before that, Courtney asked, how can I strengthen my pelvic floor? Which one of the things is the cream.
Talk about. Yep. So when you talk about strengthening your pelvic floor, so this is how I talk to people about the pelvic floor. I like to use my bicep. A bicep is a muscle with a beginning and an end. So you know when you straighten your elbow out, your bicep is fully stretched. And you know when you bend your elbow, your bicep is shortened. You see that little mound. So we have muscles just like this bicep muscle all inside our vagina and in our rectum. And these muscles, when we live high stress lifestyles, and I'm not talking about being a CEOs of a company, I'm just meaning like you run high stress versus you run more relaxed. When you run
Yeah.
more high stress, these muscles very reflexively tighten. And we think it's our body's way of protecting our reproductive parts. So they stay tight all the time. They never rest. And when a muscle is tight all the time, it can't give you good performance. It never gets to rest. It's like you being tired all the time. You never go to sleep. So you have nothing to offer. You have nothing to give. So these muscles that are tight all the time because you kind of lean towards a high stress lifestyle, they are weak because they're tight. And so the way you can strengthen them, number one, is learn to relax the muscles. So I teach people to do diaphragmatic breathing. Some people do well with doing yoga stretches like child's pose, happy baby stretch, um, the butterfly stretch. If that's not enough for people, then that's where pelvic floor therapy should be involved to help force the relaxation of those muscles. And when you relax the muscles, it gets to rest so that when it needs to contract and work on command, it's going to work better and you'll leak less or you'll have more intense orgasms. Um, and so Kegels are all over the internet. And just because something's all over the internet does not mean it's actually the right thing for you to do. I tell people there's like 5 people a year in my practice that really should be doing Kegels. Most people should not be doing Kegels. So if you hate doing
Oh,
Kegels,
wow.
yeah, then you're in luck because you probably shouldn't be doing them anyways. Um, there's very few people who should do Kegels, and the person that should do Kegels is the person that leaks with coughing, sneezing, laughing, running, walking, jumping, but literally has no other symptoms. So they
Mm.
don't ever have constipation. They don't ever struggle to orgasm. They don't ever have pain with sex. They don't have SI back and hip pain. They don't have intense urges to pee. They don't wake up at night to urinate. They always feel empty when they urinate. They never feel like they get UTIs. That is a rare person
Yeah.
that should be doing Kegels.
Yeah, that's great. Courtney just said that's great news about Kegels.
Yeah, so you can lay off the Kegels, especially if you hate them.
At what point should somebody seek like a professional like you?
I think if you've asked your doctor for vaginal estrogen cream and you're still having whatever symptoms you went in to begin with, I think that you should see pelvic floor therapy. The thing is, pelvic floor therapists were very odd. We go to undergrad, we get our undergrad degree, then we go to graduate school and we get it's called a clinical doctorate of physical therapy. Um, but the thing about most schools is that they teach us to pass our licensure exam. And the licensure exam really only has like 2, 3 questions about the pelvic floor. So most graduate programs don't teach us about the pelvic floor. So if we
Yeah.
want to know anything about this, we have to go after graduation and take more courses on how to treat the pelvic floor. So the situation that's created is that we can legally come right out of school and say, hey, I do pelvic floor therapy, but maybe ethically we have no business doing it. And so you want to ask about the training that your therapist has had. And training varies all across the country. So you could see 10 different pelvic floor therapists and be treated 10 different ways. So I tell people if you really think that you have a pelvic floor issue and you went to one, maybe 2 pelvic floor therapists, and the issue is still there, I would still consider seeing another one. Um,
Yeah.
I've been doing this since 2009, and I am typically the third pelvic floor therapist someone has seen on average. I'm usually not the first.
That's wild.
And
Well,
I've
it's
been up
very
to the eighth.
similar. You're to the audience that you're speaking to, it's very similar because we go through real estate school and it teaches us nothing about how to sell real estate. And so, yeah, somebody could go hire a real estate agent that's new and might not know what they're doing, might not have actually gotten the proper post, graduate post getting your license training and think like, oh, real estate, this agent was not good. But really, like, there are really good agents out there just
Yeah.
like you, you're like the third person. So I'm sure they're really relating to that scenario.
Yeah. So I would say just keep trying. It's and you likely will get closer to the results that you need to get to. Um, And also, it's important to go back to your doctor and say, hey, I ended up seeing a pelvic floor therapist, and this is the one that I saw that was really helpful, because then you can help like 5, 10 other women that they're inevitably going to see next, and they'll know who to
Yeah,
refer to. But
so true.
with real estate agents, real estate agents, I imagine, are like bathroom connoisseurs. Like, you know where to stop to go to the bathroom,
Yeah.
and you know which places are not good to go to the bathroom. Like, that's a pelvic floor issue. If you can't go more than 2 hours between bathroom breaks during the day, you're going too often. A normal healthy bladder should be able to wait 2 to 5 hours.
Yeah.
Another thing with real estate agents is what you're consuming can affect how often you need to go and like how often your bladder tells you, hey, I'm irritated and I need a release. So like if you're drinking carbonated beverages, if you're drinking caffeine, obviously that's go to the bathroom.
Uh-oh. She's gone. Well, I think I'm still alive. Maybe she's going to come back on in a minute. And it'll be a little weird talking to myself right now. Here she comes. Hi, Sara. Maybe not. What crazy info, though. Feel like this is fun learning about this. Well, okay, so if she's not coming back on, you guys should all, we were going to wrap up anyways. So there she is.
Sorry.
Hi. It's okay.
Hi.
She's back. I was like, wait, am I going to talk to myself?
Yeah. But the things that you drink can affect you. So like electrolytes, while they're healthy for you, they're going to make you go to the bathroom more often.
Yeah.
So drinking just like sparkling water is going to make you go to the bathroom more often.
Yeah. This is all really great information. If somebody wants to follow you, what's the best way for them to do that?
I have a website. It is sauderphysicaltherapy.com. So it's Sauder. And I also have an Instagram account. It's Sauder Physical Therapy.
Perfect. You're going to have a bunch of real estate agents start to follow you today.
Well, great.
Yeah. Well, you know, you want to know something that's kind of like crazy timing is I turn 40 in 1 week from today, and me and all of my best friends are going up to Sedona this weekend. And there's this pelvic floor therapist that I keep hearing about up in Sedona. And so I told the girls, I'm like, hey, I'm going up early because I want to get in with this pelvic floor therapist. And anyways, like 3 of my other girlfriends booked with her, and it's supposed to be
funny.
wild experience. And it just so happens that you came on today because it was a little like you weren't supposed to be on today, and here we are. And so
Yeah.
I will have to follow up with everybody and tell you guys how it goes.
Yeah, I do recommend like anyone that's curious, do one appointment. I mean, in that appointment, we'll ask a ton of invasive questions about your bowel movements, about your bladder, about your sexual function, and kind of indicate, okay, these are the things that could probably change with pelvic floor therapy, and then, get all your questions answered. The other thing I didn't really talk about much is like in perimenopause, the things that can change when you do hormones for like the whole body, not talking about the vaginal estrogen cream, but like the hormones that go into your bloodstream. A lot of doctors have different thoughts about that, but I work with a doctor specifically that does life-changing work for women in perimenopause. And so, like, doing your research on that and finding a provider who's very well informed in perimenopause can be a big game changer. Perimenopause can start around age 35. So, if you're turning 40, inevitably you've got some symptoms that you may not recognize.
Yeah, I do. I'm sure of it. So, well, this has been so much fun having you on, Sara. I have like such a good surprise, and I'm so glad that we got connected.
Yes, thank you for having me.
Yeah. All right, girls, you guys need to go follow her and make sure to reach out to her and tell her how much you enjoyed today's show. All right. Bye, Sara.
Bye.